This was a child who was in a motor vehicle collision. The CT scan is remarkable for an extraaxial collection which is located in a somewhat unusual location, what we would call the retroclival space. Let me mark that. Here we have the collection of acute blood products, which is behind the clivus and extending to the petrous apex bilaterally. This is a collection which is often very difficult to identify on CT because of beam hardening artifact from the bone of the posterior fossa. So normally we would have a lot of difficulty with identifying it. In this case, it's large enough that you see it extending down the length of the clivus to the left of midline and then up along the petrous apex. This is an isolated retroclival subdural hematoma on the CT scan. I want to demonstrate this also on an MRI scan that the patient had subsequently the same day. To identify retroclival subdural hematomas, the best sequences to look at would be the sagittal scans, because it will show the bone of the clivus as well as the collection, which is generally oriented in a superior-inferior dimension quite nicely. So this patient, as you can see, has an extraaxial collection behind the clivus as a retroclival subdural hematoma. On the T2 weighted scan, you can see that this would be a difficult diagnosis to make because of the normal amount of CSF pulsation artifact that we see in the subarachnoid space anterior to the brainstem. And it would be even more difficult on the FLAIR scans. The FLAIR scans often shows bright signal intensity in this region due to CSF pulsation. So really have to rely most heavily on the sagittal T1 weighted scan. This is post-gadolinium enhanced scan. As you can see, the collection is seen on that as well, even though the patient shows motion artifact.